We live in a world of beauty. We experience relationship, meaning, and joy. But for all its beauty, it's also a world of tragedy and trauma, burying joy, obliterating meaning, disintegrating relationships. When trauma arrives, we mobilize first responders to help the victim survive. But surviving is just the first step. Healing must go deeper, because trauma impacts a person's body, brain, spirit, and relationships. In survival mode, stress overwhelms us. Critical thinking centers of the brain go offline. Hopelessness, isolation, and shame can become crippling. These symptoms are hidden, but just as life-threatening. When painful stories aren't ready to be put into words, talk therapy fails.
What is first aid? First aid is the assistance given to any person suffering a sudden illness or injury with care provided to preserve life or to prevent the condition from worsening. Why first aid? Everyone should learn at least some basic first aid techniques, as you never know when you might need them. You could be at home, or at work, or at school, or on holiday. Whether it's a minor situation or something more serious, first aid knowledge will give you the confidence to act. You could be the difference between life and death. First aid is important because it can save lives, but it can help you do a lot more. You can spot dangers, you can help someone who has suddenly become ill, and lastly, you can help someone who is very upset. If you or your child gets a cut, scrape, or burn, it is important to clean the wound properly right away to prevent infection. Here's how to do it in 5 easy steps. Step 1. Wash your hands. Clean your hands using water or hand sanitizer. Do this before you touch your wound or treat someone else, burn, cut, or scrape. Clean and cover hands help prevent infections. Step 2. Apply gently pressure. These steps applies only if the wound is bleeding. Use a clean cloth or sterile gauze to gently press on the wound until bleeding stops. Elevate the affected part if possible. If blood oozes through the clothes or gauze, leave the covering on the wound, place another clean piece on top, and continue to apply pressure. Step 3. Rinse with water. Rinse the wound in clear water to loosen and remove dirt. Use a soft washcloth and mild soap to clean around the wound. Don't place soap in the wound. That can hurt and cause irritation. Step 4. Use an antibiotic cream or ointment. It helps keep the skin moist and ward off infections. It is not always necessary to use this if you have a minor cut or scrap, but applying a thin layer can boost your self-natural healing process and reduce scarring. Step 5. Bandage the wound sometimes. This helps keep out the germs. Remember, you must change the bandage at least once a day or when it's wet or dirty. After you clean the wound, don't pick at any scabs. They're part of healing process. Picking at them can leave a scar. And you can call your doctor if you notice any of the following symptoms. They could mean the wound is infected.